Welcome to Care to Share, a program bringing you the latest news in breast health. It's filled with information for women of all ages about risk factors, prevention, the latest imaging and diagnostic tools, and the treatment of breast cancer. We'll talk about some of the myths surrounding this disease that strikes 1 in 7 women worldwide. It's important to openly talk about breast health, since breast cancer death is the leading cause of cancer death among U.S. women aged 20 to 59. In the past 50 years, the lifetime risk of a woman getting breast cancer has tripled. This program is divided into segments. You can watch each segment separately or the entire program. It's your choice. We hope that once you viewed this DVD, you would pass it along to a friend, caring enough to share this valuable information. Let's begin. All women, regardless of age and family history, are at risk for breast cancer. But unlike lung cancer, whose risk can be directly linked to smoking, there is no one risk factor that absolutely guarantees a woman will get breast cancer. When all known risk factors are added together, including family history, as much as 50% of breast cancer cases are unexplained. Let's look at some known risk factors. Scientists and doctors study risk factors to give us hints as to the cause of the disease, so we can find tools for its prevention and cure. Your risk for developing breast cancer increases as you get older. In about 80% of cases, breast cancer occurs in women over 50. But this does not give the all clear for younger women, since about 1 out of 8 invasive breast cancer diagnoses are among women younger than 45. Fat cells can make estrogen. We know high levels of estrogen increase your risk for breast cancer, so it's vitally important that women of all ages maintain a healthy weight. The younger a woman is at her first period, and the older she is when she goes into menopause, the more risk she has of developing breast cancer. That means if a woman menstruates for more than 40 years, she is at particularly high risk. Hormone replacement therapy, used by postmenopausal women to relieve hot flashes, night sweats, and other symptoms for 5 years or more, have a 53% increased risk for breast cancer. But if a woman uses hormone replacement therapy for less than 5 years, they are at low risk. Beer, wine, and hard liquor all contribute to breast cancer risk. As your consumption rises, so does your risk. Scientists have found that having 2 drinks a day over time increases estrogen in the blood. But studies show that if a woman eats a diet high in folic acid, which is found in spinach, broccoli, corn, and legumes, and they take multivitamins with folic acid, her increased risk of breast cancer due to consuming alcohol lessens.
I would tell a woman who is concerned about genetic history as far as her chances of developing breast cancer that only approximately 10% of women with breast cancer do have a positive family history. Inherited genetic mutations that predispose to breast cancer are also quite rare. There is genetic testing available for the most common inherited genetic mutations, and these would include BRCA1 and BRCA2. If a woman is concerned that she may be at increased risk due to heredity and she has a mother or a sister or a daughter who is affected, I would tell her to discuss this with her doctor, and then her doctor could refer her on for genetic counseling at that point.
Years of breast cancer research has found real ways in which women can reduce the risk of getting breast cancer. Here's what we know. Weight gain is a risk factor for breast cancer. Fat cells make estrogen, and high levels of estrogen increase your risk for getting the disease. It is recommended that women eat a diet low in animal fat and high in whole grains and fruits and vegetables. Exercise is important for overall good health. A University of Southern California study has shown that women who exercise 4 or more hours a week during their reproductive years have a 58% decrease in breast cancer risk. To reduce your risk of breast cancer, The American Cancer Society recommends at least 45 minutes of intentional physical activity 5 or more days a week. Tamoxifen is a prescription medicine that blocks the estrogen receptors in the breast. When women take tamoxifen as a treatment after breast cancer, they have fewer recurrences of the original cancer and 30 to 50% fewer cancers in the opposite breast.
Tamoxifen is a medication that's been around for several years. It is the first hormone therapy that was widely available. And actually, that's a bit of a misnomer because it actually blocks estrogens. And that's how it works. It prevents estrogen, which is cancer promoting, from attaching to the breast cancer cell. And when it can't attach, it can't stimulate the growth of that cancer cell. Yeah, aromatase inhibitors are the second generation of hormone therapy above and beyond tamoxifen. They are based on the principle that they help to prevent certain chemicals in the body from being converted to estrogens. And in so doing, by blocking that, then estrogen is not available to stimulate the growth of breast cancer cells.
Healthcare professionals have come up with a top 10 list for practical prevention. Take a multivitamin with folic acid. Exercise enough to break a sweat for at least 30 minutes 5 days a week. Maintain a normal, healthy weight. If you have a choice, have children before age 30. Breastfeed your children. Avoid unnecessary x-rays to decrease radiation exposure. Drink alcohol in moderation. Avoid taking hormones, as in hormone replacement therapy or fertility drugs, unless necessary. See your doctor immediately if you notice any breast symptoms like lumps, pain, or nipple discharge. Have a mammogram every year between the ages of 40 to 50 years old and every 1 to 2 years after age 50, or as your doctor recommends.